Today's topic is ongoing risk assessment. Introduction. Risk assessment in pregnancy help to predict which women are most likely to experience adverse health event and enables provider to administer risk appropriate perinatal care. Low risk can be defined as regionally or locally within the context of collaborative care. So risk assessment in pregnancy is very essential to evaluate or to detect the risk factor which are present in the woman and which may cause adverse health events. So the purpose of risk assessment is to predict which women are most likely to experience adverse health event. When thinking about risk appropriate perinatal care, it is important to consider the preconception care, identifying modifiable risk factor and emphasizing prevention, antepartum care, antepartum or intrapartum care and neonatal care. So risk assessment is a predictive value, means before any problem we have to identify or regularly so that any outcome came. So sometime the risk in the prenatal care have to be considered from the preconceptional care. So there are many modifiable risk factors which emphasize and which can prevent the risk in any antepartum care or intrapartum. Or antepartum means during the time of pregnancy, intrapartum during the time of labor, means ki both mother and baby, and neonatal care is included after the baby is born. Assessing women for clinical risk should happen before pregnancy, throughout pregnancy, and in labor, as a risk factor can change at any during gestational time, sometime necessitating a change in care plan and intervention to mitigate those risks. So, generally, the risk assessment can be continuous process which is continue throughout the pregnancy, and it is better than before the pregnancy. In preconception time, the women have to go for regular checkup and identify the risk factor, and some risk factor can change according to the duration of gestational time, and some changes are very essential so that the risk factor can be reduced. Screening of high risk cases. Screening is a process of identifying apparently healthy people who may be at increased risk of a disease or condition. They can be offered information, further test and appropriate treatment to reduce their risk and any complication arising from the disease or condition. So there must be essential that we have to screen the high risk cases, means we have to identify the high risk cases, and then because the increased high risk cases have the chances more for disease or any adverse condition. So there must be test and appropriate treatment so that the risk factor can be reduced. The cases are assessed at the initial antenatal examination, preferably in the first trimester of pregnancy. This examination may be performed in a big institution teaching or non-teaching, or in a peripheral healthcare center. Some risk factor may be later appear and are detectable at subsequent visits. So generally the antenatal examination is done during the first trimester of the pregnancy, or before once the pregnancy is confirmed. So it can be done in any institution where the professional health worker in the teaching or non-teaching or in a peripheral health center can examine the woman for the risk factor. And there also the risk factor can be also appear in later pregnancy or later stage of antenatal time. So there must be detect any abnormality in subsequent visit of the woman. The risk cases should be reassessed at each antenatal visit to detect any abnormality that might have arisen later. So risk assessment must be done every antenatal visits for any kind of abnormality. So example, pre-eclampsia, anemia, RH, isoimmunization, high fever, polynephritis, hemorrhage, diabetes mellitus, large uterus, lack of uterine growth, post-maturity, abnormal presentation, twin and history of exposure to drugs or radiation, acute surgical problems. So the example of the rise in risk are preeclamptic condition or an anemia present in the woman or RH incompatibility. Sometimes high fever is also chances of infection and pyelonephritis, hemorrhage and any kind or the diabetes. Sometimes the uterus is large or sometimes reduce the growth of the uterus and post maturity and many times the fetus is abnormally presented, means the presentation is abnormal and history of any radiation and drugs can cause the high risk pregnancy. Thank you so much.